Right By You is a nursing service. It's there to provide people with an extra layer of support on top of the hospital, the GP and the community support that is already available to them. It's for people who need a personalised approach so that we will be able to tailor the care that they need according to their wishes and their priorities, always keeping in mind the medical health needs that are required. Oh, the thing I've enjoyed most working in Right By You has been the ability to meet patients so fully, to have the time and space, to have a proper reflective conversation, to get to know them a bit better, and to be able to help them with the things that matter most to them, that make the biggest difference to their lives. I think that Right By You gives patients a time and a space to look at how they feel about things, to focus on themselves, to encourage them to focus on themselves, to find out and explore alongside somebody safely how they feel and the things that concern them and the fears that they may have, so that we can look at how we can help support somebody in achieving their objectives with these issues that arise, so that these things don't remain hidden, so they can deal with them and then they can face their futures and their treatment and their family. Right By You meets people often at a time of crisis. Now, the reasons for that crisis are going to be individual for everybody. Sometimes they're about, like for my in my previous case, about that loss of independence, that loss of purpose in life. It might be about fear of treatment, it might be about fear of death. It can be a range of different things: fear of talking to children, fear of talking to parents. It can just be so many different things for people. Right By You are involved in it, in the care of a patient. Our focus is on personalised care, but we do often meet people in crisis. And it's very important for us to be able to spend the time to unpick the causes and reasons for this crisis for people. And it may not be the obvious one that they have a diagnosis of cancer. It can be many, many things that occur within their life. And during that time, we look at not only what the crisis is, but what the person would need or feel was a way towards the resolution. And there may be many steps towards helping them come to terms and find a way of living meaningfully with their diagnosis and the other things that happen in their life. But there are very often examples that they've had previously in their life of when they have managed tough times. And we may talk about those so that we can get an understanding of how they do respond to crisis, so that we can match the current situation and utilise their internal strengths. It's about helping people to find their own way so that we can support them as they tread carefully along the path that they desire.